My name is Sharon Jeruto from Nandi County, from the Nandi County Civil Society Network, an organization called Arise Nandi Empowerment Initiative. So today, for 2 days, we are having an event organized by the National Taxpayers Association that has been so far quite fruitful, and we are grateful for NTA for organizing and to give us capacity or to enhance our advocacy skills. We looked at the budget cycle, which is what we interact with every day, but today it was with a touch of focus on health financing. We looked at 3 previous financial years, watching or analyzing the trend of what has been allocated to the health sector. We looked at the percentages, or the percentage it forms on the whole budget of the county, what forms, how much goes to development expenditure, how much goes to recurrent expenditure. So we looked at all those breakdowns and how it has been, the trend, how it has been going. So we would also ask questions on why the trends. And this was with the aim of helping us better our voices in advocating for transparency in financing in the health sector. So that was the main objective. We went through the 4 stages of the budget making process: the formulation, the implementation, there is the audit process, and there's also the approval. The approval stage comes just right after the formulation. We looked at the several actors in those stages, like in the formulation, the executive, the approval, the county assembly, and the citizens, and the implementation, which is also the citizens and the executive, and the audit process, where the citizen is also there, working with the Office of the Auditor General. So the highlight here was to remind us also that in each one of these stages, the citizen is actively involved. There's no point at which the citizen is not involved. And it is at this point that we need a knowledgeable citizen who understands what should happen so that they can advocate or they can raise their voice on what can be done better in health financing. So at the end of the day, we had asked ourselves several questions, looked at the gaps or the points at which we could raise our voices and eliminate any malpractices, or just to ensure that the citizen fully participates in this process. The other thing that we also looked at in the process are the legal frameworks, which is very important for a citizen to understand what is involved in the legal framework. The Constitution of Kenya, the Public Finance Management Act of 2012, the Public Finance Management Regulations of 2015, and any other legislation that covers the budget making process. But today we were really having a focus on the health sector, and it has been quite interactive, fruitful, and we have gained a lot of skill today. So we are quite grateful for the 2-day interaction that the National Taxpayers Association organized.